Imagine a Nigeria where healthcare is accessible to all, education is prioritized, and small businesses thrive. This is the Nigeria that Peter Obi envisions, and his recent visit to Indonesia is a crucial step towards making this vision a reality. As the 2027 presidential election approaches, Nigerians are reminded why Peter Obi is the leader they need. Indonesia, a country with a population of over 273 million people, has made remarkable strides in healthcare, education, and economic growth. Peter Obi's visit to Indonesia was an opportunity to learn from their successes and apply these lessons to Nigerians' unique challenges. As he shares his findings, it becomes clear that Nigeria can benefit greatly from Indonesia's innovative approaches. In his quest to share these valuable insights, Peter Obi highlights 3 crucial lessons Nigeria must learn from Indonesia now. These lessons have the potential to transform Nigerians' healthcare, education, and economic landscapes. Let's dive into these crucial takeaways and explore how they can shape a brighter future for Nigeria.
3 crucial lessons Nigeria must learn from Indonesia now. I recently returned from a trip to Indonesia, and the experiences and lessons I gathered from various sectors that are crucial for Nigeria's growth and development. In this report, I will share some of the key takeaways from my meetings with government officials, focusing on Indonesia's achievements in health, education, and economic development. 1. Universal health coverage, a model for inclusive healthcare. My first meeting was with Indonesia's Minister of Health, Mr. Budi Gunadi Sadikin, where we discussed Indonesia's National Health Insurance Program (JKN). This initiative has seen remarkable success, currently covering about 98% of the population, which is an impressive feat considering the size and diversity of the country. This universal coverage model ensures that healthcare is accessible to all, particularly the poor and vulnerable. In Indonesia, the government has made preventive care a cornerstone of its healthcare strategy, aiming to reduce the disease burden through proactive measures rather than reactive treatments. This approach involves improving public health awareness and making healthcare services more accessible in remote areas. By focusing on prevention, Indonesia has been able to reduce healthcare costs while improving overall health outcomes. A key aspect of this success is the government's policy of fully subsidizing insurance premiums for low-income individuals. Additionally, Indonesia is making a concerted effort to expand the training of primary healthcare workers, even in the most rural and underserved areas. This is something Nigeria urgently needs to prioritize, expanding healthcare access to the most remote parts of the country and training more healthcare professionals who can provide essential care at the grassroots level. 2. Education, investing in the future through quality and access. Next, I had the privilege of meeting with Professor Dr. Nunak Savoni and her team at Indonesia's Ministry of Education. We discussed Indonesia's education system, which serves about 50 million pupils at the basic education level with a workforce of over 3 million teachers. The country has made remarkable strides in achieving universal access to education, with a 99% school enrollment rate due to its strict implementation of compulsory education policies. One of the key takeaways from this meeting was Indonesia's commitment to teacher quality. All teachers are required to have a degree and undergo professional certification. This ensures that students are receiving quality education from qualified instructors. Nigeria, in comparison, has a significant teacher quality gap, which directly affects the quality of education our children receive. The Indonesian model is one we should aim to replicate. Education is an investment in the future, and quality education is non-negotiable. Additionally, Indonesia allocates 20% of its national budget to education, a percentage that reflects how much the government values education as a critical pillar of national development. For context, This is an area where Nigeria lags significantly. The more educated a nation is, the better its future prospects. For example, while Indonesia boasts over 4,000 universities, Nigeria, with a population almost 80% of Indonesia's, has fewer than 200 universities. If we were to follow Indonesia's model, Nigeria should aim to have at least 1,000 universities to meet the educational demands of our growing population. 3. Economic development. Empowering MSMEs for national growth. The final segment of my trip took me to Indonesia's Ministry of Micro, Small and Medium Enterprises (MSMEs), which plays a critical role in the country's economic growth. MSMEs in Indonesia contribute a staggering 61% of GDP and employ 97% of the workforce. These statistics underscore the importance of small businesses in driving the economy forward. Indonesia's approach to MSME development is comprehensive and supportive. The government provides mentorship, training, equipment, and financial support to these businesses, ensuring that they have the tools necessary to succeed. Furthermore, Indonesia has dedicated about $20 billion in loans to MSMEs, with a low interest rate ranging from 3% to 6%. The government covers the difference between the commercial loan rate, which hovers around 12% to 13%, and the rate offered to MSMEs. This low interest rate model has been a significant factor in the success of MSMEs in Indonesia. In stark contrast, Nigeria's MSME sector faces numerous challenges. Over 40 million MSMEs are operating in Nigeria, yet the total loan amount allocated to them is less than 10% of what is available in Indonesia. In addition to this, Nigeria's small businesses face barriers such as high interest rates, inconsistent power supply, inadequate infrastructure, and a lack of skilled workers. For Nigeria to experience sustainable economic growth, we need to create an environment where MSMEs can thrive, just as Indonesia has done, providing access to affordable credit and creating supportive policies for entrepreneurship will be key to boosting our economy. The bigger picture, learning from Indonesia's success in these areas, healthcare, education, and economic development offers valuable lessons for Nigeria. These sectors are the backbone of a nation's progress, and Indonesia has proven that with the right investments and policies, it is possible to create a more prosperous and equitable society. One of the most striking aspects of Indonesia's approach is the comprehensive support it offers its citizens and businesses, whether it's subsidizing health insurance for low-income individuals, providing quality education for all, or empowering MSMEs through financial support and training. Indonesia has taken a holistic approach to development that Nigeria can emulate. For Nigeria, the path forward is clear. We must invest more in healthcare and education, ensuring that every Nigerian has access to affordable healthcare and a quality education. At the same time, we must empower small businesses to thrive, which will create jobs and stimulate economic growth. The lessons from Indonesia are not just theoretical. They are practical, actionable steps that can lead to a brighter future for Nigeria. Conclusion: a new Nigeria is possible. Indonesia's progress is a testament to the power of strategic investments in people, education, and small businesses. As we look toward the future, Nigeria must take these lessons to heart and act swiftly. By focusing on health, education, and economic empowerment, we can create a new Nigeria, one that is more prosperous, more inclusive, and more resilient in the face of challenges. Indeed, a new Nigeria is possible, and the time to act is now. Report by Peter Obi.